Kidney stones form when calcium in the urine binds with other minerals that are in the urine, such as phosphorus, oxalate, uric acid, citrate. There are a number of different chemicals that are in urine. So you have to get a certain amount of those chemicals or minerals together to form a stone, just like you would see in a solution. If you're adding in different minerals, you would start to see them crystallize when they reach a certain level of concentration in the water. Most people understand that when they get a kidney stone, they feel pain, especially when they begin to pass the stones. A lot of people may have asymptomatic formation of stones. In other words, the stones can form in the kidneys because of that imbalance of minerals. But if they're not shifting or passing through the ureter, you may not necessarily get back pain or any type of clinical symptoms. Well, the risk is that as they build up over time, they're going to cause change in kidney function. They may affect the ability of the kidneys to filter properly, the abilities to excrete wastes, and eventually cause kidney failure. Certainly, there's also the risk, obviously, again, of pain, of obstruction, of blocking the ureters so that you can't empty the kidneys of urine, which of course will also affect kidney function. The first rule of treating kidney stones, or at least the first recommendation that always is recommended by us as nephrologists, by the big gurus in the field, is to drink as much water as possible. And generally we're talking about normal daily intake of water should be somewhere around 64 ounces or 2 liters. And for stones, it should be even more than that. So if you are a stone former or someone who has had kidney stones, 3 liters or more would be recommended. Doing exercise, you have to make sure you're staying hydrated. So if you're normally taking in 2 liters of water or 3 liters of water and you then go and exercise, then you have to compensate for the amount of fluid that you're losing through perspiration. Along with that, a low sodium diet, because sodium generally causes fluid retention and will affect the imbalance of minerals in the urine. So if you're on a low sodium diet with an adequate amount of fluid, oftentimes that is enough to prevent kidney stones from forming. The best way to lower sodium in the diet is to eat fresh foods, fresh vegetables, things that are not processed, and things that you would make yourself from scratch, as opposed to things that come from a can or from a frozen boxed food or something that's overly processed, because a lot of those foods have a much higher sodium content. Also, when you eat out at restaurants, you don't necessarily control the amount of sodium that they use in the cooking process. You can certainly control the salt shaker and not adding salt after cooking, but that's something you have to be worried about, that foods that are prepared for you may have a higher salt content than foods that you make yourself from scratch and from fresh ingredients. The next thing from that is more tailored to the type of stones that you make. So everyone has calcium in the stones. It's not so much the calcium, but the other minerals. So if you're a high oxalate, if you have calcium oxalate stones, then a low oxalate diet. Also taking in calcium during your meals to block the absorption of oxalate from the meals. And oxalate you'll see in beef and things that are higher in protein. So the most common symptoms of a kidney stone are when you feel pain, Some people, like I said, may not feel pain, but they may see blood in the urine. So if you have pain, if you have blood in the urine, or you have the inability to urinate, or urinating frequently, or have painful urination, or you notice gravel or sand or something that, the urine is not necessarily clear, those are all potential signs of kidney stones. If you form kidney stones, and you form more than one stone in your lifetime, so 2 stones or more, then technically you need to be worked up for being what we call a stone former, someone who has a recurring issue with this higher concentration of calcium and other minerals in the urine. To determine what that is, you should see a nephrologist who would then order a special type of 24-hour urine collection that analyzes the urine specifically for minerals. We in our practice use a lab called Litholink, where we actually send the urine specifically to this one lab. They analyze it and give a very detailed printout with recommendations that also include diet, fluid intake, as well as some of the potential medications that you might need to help to put the urine chemicals back in balance so that you're not repeatedly creating stones.